Good morning, everybody. I hope you had a good weekend. Last week in our toolbox discussions, we had talked about emergency action plans. This week, we're going to talk about emergency on the rooftop, in specifics, a heart attack. Heart attacks can happen to anyone at any time. Now, there's a difference between sudden cardiac arrest and a heart attack. One is a plumbing issue and one is an electrical issue. With sudden cardiac arrest, you have a complete arrest, cessation of breathing, meaning they're a non-breather at this point when they have sudden cardiac arrest. A heart attack is a block that can usually be managed until you get to a medical facility with aspirin. But typically, your cardiac arrest is a true emergency situation. That person has coded and they essentially have died. Just a small tidbit, this is an automatic external defibrillator. For every minute that you go without a defibrillator during CPR, your chances decrease by 10%. So if you have to wait 5 minutes for an AED to show up on the scene of a cardiac arrest victim, their chances decrease about 50%. 911 should be your first step. Always activate the EMS system. Remember, you guys are working on a rooftop and you have to relay these specifics to the 911 dispatcher because they have to dispatch the appropriate emergency equipment. One is going to be a ladder truck. If you have a crane on site, they may utilize the crane to get the victim down. It's a good idea to have an emergency information poster specific to each project that has 10 or 7-digit telephone numbers for the local hospital or emergency medical services. Cellular phones do not work everywhere, so you have to keep this in mind while you're doing your emergency action plan. The first thing you want to do is assess Randy's breathing. This should only take 10 seconds. You want to look, listen, and feel. You want to listen for air exchange. You want to look for the chest to rise and fall. If it's not falling, Randy's not breathing. He's in cardiac arrest. There's a difference between a heart attack and cardiac arrest. Cardiac arrest is a true emergency. At this point, Randy is clinically dead. You're not going to hurt Randy at this point, but what you have to do is perform CPR. You have to expose Randy. The first thing you want to make sure is that your own protection is vital. So I'm going to expose Randy's chest. I'm going to look for the pinpoints, which is usually the nipple line. And I've got my gloves on. I've got a barrier device. I'm not going to swap spit with Randy. Just let you know, when somebody suffers from cardiac arrest, they usually defecate themselves and normally they throw up. So what you'll want to do is wipe away, especially if you have an AED available. You want to wipe that skin off because the profuse sweating is like somebody dropping buckets of water on you. You want to do the head tilt, chin lift. You want to open up Randy's airway. Look, listen, and feel. Randy's not breathing. You want to start CPR and then activate the 911 system. Send someone to meet the paramedics to guide them to the roof. Remember, this is going to be a rescue because they're on a roof. It's very difficult to slide somebody down a ladder. It can be done, but we do not carry that equipment. Call your office to provide information and regular updates. Always, foremen or superintendents, if you have this event on the rooftop, make sure you go to the hospital. You don't have to take them. I'm sure the medics will take them, but you should go to the hospital and give family updates, and that way you're able to communicate with me as well. If you have any questions about medical emergencies and how to better equip yourself with, just ask. And there will be trainings coming down the road that will make you feel confident.